Today we are going to focus on our glutes, especially throughout the pregnancy and anyways throughout your life. Your glutes need to be active, whatever you perform, rather sleepy and inactive. So I'll tell you why. That could happen when you are pregnant. Your muscles at the glutes get weaker, so many women experience losing their bum. Including myself, I experienced that. That's why I decided to make this video. When your belly starts to grow, the gravity changes, so your posture starts changing. And because of that, we tend as a woman to tuck the butt in, kind of slouch forward with the chest, and kind of protecting our little one that is growing there. But what it does, it puts pressure on your quads, and these guys are inactive. So when you do this on a daily basis, these guys are not working. So therefore we need to make sure we keep the muscles engaged throughout the pregnancy in your glutes. It will help you in your labor, because to take certain positions and hold them for a long time, or even for pushing, it will assist you, including if you complain and your lower back is suffering throughout the pregnancy or later in the pregnancy. You want to train your glutes as well as your transverse abdominals muscles, making sure your pelvic floor health is nice and strong. Today we are training glutes, and therefore you will need a chair or a block. A block I use just to elevate the space so that when you sit, your knees are not kind of tucked in, yeah? So you need to make sure there's a space for your bum. Depending how big is your bum, that's why it's perfect if you're in a third trimester, even better. Now, this, you can use a chair as a table or something to hold on to so that you keep your posture straight, yeah? So because we will lean forward, and that will help you to protect your back. And we will use also the stability ball that I would suggest every woman to sit on and start bouncing, especially into the third trimester, because all the pressure, you will feel the difference sitting on a chair or sitting on a stability ball if you have an office job. We will need a resistance band, chair. If you need something to elevate yourself, you can roll up another mat and place it underneath your hips. The table, something to hold on to, and also the big stability ball aligned with your height. I'm using block to elevate my hips so that my knees are not higher than my hips. Ideally you want to be the same level or slightly lower, that's okay. I will guide you through, we'll do it together, and because I decided I was doing it on my own and I found it very powerful, and I think you should do it with me as well. Okay, even if you're not pregnant, this is perfect for you. So this is stable, low impact. If you're in the third trimester, you want to sit down before you put the resistance band on to make sure you are aligned with your hips. So we'll start with 45 seconds action mode. We'll do the glute activation while sitting on a chair, and then we'll perform squats as well. 3 rounds, and then we'll move to another combo, and we have 3 combos in total, and then we'll end up with the stretching. Okay, mama, I hope you're ready because we will get some glutes activated today for sure. Okay, let's start. Sitting on the edge of the chair wherever you are, and now slightly lean forward on your toes, and then bringing your knees outwards. Okay, I'm using this because it supports me to keep my spine straight, and also to just make sure that my posture is perfectly aligned while I'm just focusing on my hips. Now we want to bring your knees as wide as you can and pulsate outwards, and don't prevent them from going closer to each other. Okay, so we'll have another 5 seconds to do it. Keep your spine straight, engaging that core. Keep your TV airtight, and 1. Perfect. Okay, let's continue. 15 seconds gone, let's continue with the squats. So bring yourself down and up. So when you squat, your knees are not passing your toes. Coming up, I want you to squeeze those glutes. Inhale, exhale. Now I want you to go a little bit lower, and I will come up, and therefore I'm removing this block. Inhale, exhale. As we go down, we want to push your knees outwards, coming up, pushing them outwards. We want to prevent your knees caving in. Therefore, we want to make sure outer hips are working powerfully. Inhale, exhale, coming up, squeeze, engage your core. Inhale, exhale. Again, if you need to support yourself forward on the table, please do. Okay, that was 45 seconds. So we'll do 2 more rounds left. So get yourself ready in a position, and we're going back to the glute activation starting in 3, 2, 1. Perfect. Coming your toes, leaning forward, hips are back, and moving your knees in and out as much as we can. Again, because my spine is still, I like to be supported. But that will look like this if you're not holding onto the table. And that's okay, fine as well, but I start to feel that I need a little bit of support just because of my bump. It has grown so much. Okay, we have 15 seconds left, and then in 15 seconds rest, and we'll go for squats. Okay, keep going it. This workout is very low impact, so your joints are all stable. That's that. Now rest. Now get rid of this block, as I really like to do deep squats, and my flexibility allow me to. Some people can't squat very low, and that's okay. Do your thing. Inhale, exhale, coming up, squeezing those glutes. Inhale, exhale. And really great way that your chair is at the back, because you know that you can bring those hips further back as much as you can, keeping your spine neutral. Therefore, meaning where my spine goes, my neck goes. So I'm not looking up here, but I'm actually going together down. Make sure you're coming up, squeezing those glutes. Inhale, exhale. If you want to progress, you would hold the weight on your shoulders or down to your sides, okay? I will make it light and bright for you. You can progress this way. Good. And rest. Perfect. We have 15 seconds preparing ourselves. So you see, if I'm going up here, my knees are too high. So I need to get this sorted for myself. You can find any cushion, anything you like. We'll start in 3, 2, 1. On your toes, knees as wide as you can, and pulsate as fast as we can. And we are going for it. So this is round 3, and then we'll move for our next combination. Combo of 2. That's how I like to call them. I always make my own names because I realized everyone does it, so I'm just gonna do the same. So we have 20 seconds. Now I'm sure you start feeling it already here in your glutes. If you don't feel it, try to position your feet maybe closer, maybe a little bit further. So then you will notice what is stopping you from feeling your glutes in this moment. 2 and 1. Perfect. 15 seconds. We are setting ourselves for squats. And really pay attention to your technique, knees not caving in, feet slightly wider than your shoulders, a little bit outwards, 11 o'clock, 1 o'clock. And let's begin. Inhale, exhale, inhale, exhale. Remember, neutral neck, I told you. So we are keeping that cell as long as I'm looking at you, or there's a mirror in front of me too. That helps me to check the posture. But when you are secure, when you know your posture is perfect, you get around this idea, then you can already focus and just look at one point. Inhale, exhale. As I talk here, I also need to breathe. I have this bump in front of me and it demands oxygen. Good. We'll start, we have another 5 seconds. Inhale, exhale. And round 2, we are moving into the glute dance. That's how I named it. We are putting resistance band, which is medium strength, around the ankles. And we will literally, you can hold on to as well the table or whatever is a bit higher, or you can just hold on to your hips. That's also fine. And then the second one, after that, we will again hold on to the table or anything that is a little bit elevated, and we'll bring the resistance band up, and we'll go with this one. So we are going into the half squat this time, engaging that core, keeping neutral neck. Squat, exhale, squat, exhale, squat, and leg rise. You will feel on this side more than the one that you're lifting up, and this is perfect. I hope you're ready to begin, because I am. Okay, we'll start in 3, 2, 1. We're going for that glute dance, okay? Keep neutral neck as much as you can. And what we want to do here is keep your feet as wide as we can and just making sure that imagine you want to tear it apart and you just walk around. You can walk around the room while in this position, and then you start feeling it here. If you don't feel it, try to position yourself in a different way so you start getting it. So if you need the support for your back, engaging that core, you can hold on to the table or anything that is more elevated, and just going for it. We have 5 seconds left. 3 and 2 and 1. Excellent. Now you can use the chair to come up and bring that resistance band up, because what we will do, we'll do the half squat and then lift the leg up. Okay, ready? And let's go. So squat, lifting that left leg up, only left leg up. Exhale. So without holding on to, that would look like this. Exhale. Inhale, exhale. Inhale, engaging core, lifting that leg up. Exhale. Inhale, exhale. Supporting your lower back even more. I'm not using my hands for lifting that leg, but I'm just holding on to. There's a little bit support here, but this is perfect. Good. So we will first round we'll lift the left leg. Then the second one right. The last one we will split the time into the halves. We have 3 seconds, 2 and 1. Beautiful. Now going back to the glute dance. Get ready. We have 10 seconds. Again, we will lean slightly back, soften your knees. I'll go side to side. Ready? 2, 1. Let's begin. Now it's your choice, holding on to or not. So simple as that. But perfect. Now I start to feel those glutes even more, that they are actually working, even if I do this. And just keep dancing. Glute dance, because what you need to feel is the most is your glutes. Again, need support for your bump. Release the pressure from your lower back. Hold on to something and just go for it. Excellent. You're doing so well, mama. If you keep up with me till now, you are rocking. Okay, let's start for 5, 4, 3, 2 and 1. Excellent. So round 1 done. Let's go for round 2. Bringing that resistance band up. See if you can still bring it up. We have 5 seconds. 4. We're now lifting the right leg up. 3, 2 and 1. Bravo. And let's go. So half squat. Inhale, exhale. Keeping that belly engaged. And be gentle with yourself. If you don't feel something if you feel like something is off, don't do it. Maybe repeat the first one that I did, glute dance, instead. And do it with me while I do this. Don't force yourself, especially if you're experiencing any pain or discomfort. Stop it immediately. You can reach out to me and I can give you advice. What could that be? Maybe you need to do some stretches, glute release, and so on. We'll have 3 seconds, 2 and 1. Beautiful. Perfect. Now it's round 3. Hope you're ready, mama, because now we are doing, no, actually this is still round 2. Back into the glute dance, right? Am I? No. Glute. I don't remember, I mixed it up something probably, I don't know. No, this is round 2. Yes, round 3. So we are starting with the glute dance and then we do that, where we will split the time. That's what I want to say. Blame my pregnancy brain. And exercising, what it does, sometimes it even switches your brain power off, because it goes, the energy needs to go on the vital organs and switch out the energy, but it's all okay. When I'm tired, my brain power is off first round. Let's go for 3, 2 and 1. Perfect. If you need to sit down on a chair, bring that resistance band up. And now we'll split 45 seconds in half, and we'll start with the left leg lift. So half squat, lift the leg up. Ready? Let's go. So half squat, leg up. That's starting with the left one, okay? It's your option to hold on to here, but mama, you don't need to force yourself. All we want is focus on those glutes and the hips as well, because this one is glute and the hip. Perfect. Now we're shifting to the other leg. Yeah, let's go. So half squat, bring it up. Half, bring it up. Always watch your belly is doing. This is safe. Again, if you feel in your lower back in this position, go back sitting on a chair. Do the glute activation, what I did before. While we do this, come back to it. It's simple. Do what's right for you, mama. And release. Beautiful. We have done 2 combos. Third one is coming. Okay, mama. Remember, now the third combo involves our stability ball. So, again, sit down, mama, if you need to. Put resistance band on, because we have our hips occupied with this little ball. I call it water balloon. What you want to do is bring your ball into the position, okay? We don't want any doming happening in your belly while you position yourself. You can have the ball against the wall. What will happen? You will roll up and come up and squeeze your glutes up. Yeah, inhale and exhale. Now, when you come up, what I want you to do is make sure you're not arching your lower back. Therefore, imagine there's strings between ribs and hips. The strings tighten up. So pulling those glutes up and really squeezing them. You can actually test them, try them on. Try them on. So anyways, so we'll go with those ones, and then we will stay up and we will pulsate. I'll set the timer for myself, and we are starting in 3, 2, 1. You are down there, coming up, squeeze, pull your knees apart. Inhale, exhale, squeeze, knees apart. And let's go. Keeping your head, you can also keep your head vertical to not get too dizzy or so. So you can hold with one hand your head and bring your hips up. Plus you can also place the weight on your hips to make extra. For if you have done this exercise for a while, you might want to progress. That's also possible. So placing dumbbells on your hips and going up and squeezing it up. We have another 8 seconds left. Inhale, exhale, inhale, and exhale. Perfect. Last 15 seconds. We will go with knees in and out, in and out. Keep your glutes up. Don't let them drop. You can literally keep it up. Again, some people don't like it to hold your head, so hold with your hand, support it. Okay, and round 2. Let's go. Coming down and up. This time we'll do less breaks, because these single bridges are quite easier, because this gives you rest. You come up and squeeze. You have a rest, come up and squeeze, okay? So this is a little bit more, less rest. You get more stuff done in a short time, and I'm sure you know everyone is busy nowadays. less training involves less time, then there's no excuses, because the training takes like 20-30 minutes, and that's fine. Keep your hips up, and let's go 15 seconds. We are pulsating. You might feel soreness already, or not, but keep reset yourself and then start again, or pause this video. Round 3, let's go. And coming up, squeeze. Inhale, squeeze. Inhale, squeeze. You can hold your head for support or not. It's really up to you. If you're used to do this, then these muscles are quite strong and they're not gonna feel pain. Like I feel it less, but for those people that are always on the laptop, it's a bit different story, because doesn't matter. It's not only what you do in a session, it's also what you do after the session, how you hold your body, how you behave, and what is your routine. You know, left-handed, right-handed is also the same. It's gonna make a difference. And ready? Let's go. Bring your hips up and pulsate. So I am 6 weeks away from my due date, and incredible, the time went really fast, so I didn't even notice. Now mini rest your hips up, because what I want to do now, we will go with pulsation. We'll bring hips up and down, up and down. So now bring your hips up, hold it. Now I have kept this chair for a reason, so that my ball doesn't wiggle. So I will bring your knees wider apart, and literally I will keep my hips up and will keep squeezing those glutes up as much as I can. And really, this the only muscle that is working is your glutes. Plus you have this belly weight that is supporting and giving your glutes extra work, okay? Keep squeezing them, bring it up and down. It's very short and up. Exhale, up, exhale, exhale. Keeping your knees wide as you can. Your hips are also active, and this is also good for your pelvic floor, because it's all linked with your inner thighs, with legs, with everything, your glutes especially. Now we'll pulsate for another 8, 7, 6, 5, 4, 3, and 2, and 1. Mama, slowly roll yourself down, and the way you can go on the side to not hurt your belly, to prevent any doming happening. If you want to ask what is doming, I have created a video about it, so where I dive deeper about it and explain more. Now, this is how I come up. So making sure you always roll like a ball. See this ball? This is how you need to come up and go down onto the floor or from the bed. And we will move on to the stretching. What we want to stretch is we want to stretch our glute. So therefore, there are several ways you can do it. So you can use the chair, something to support yourself. Now you place your feet on something that elevates. Could be rolled mat or block in my case. Could be something that shapes this size. So what you want to do, you want to lean slightly forward, pushing your hips back. Feet the same with your shoulders, and now like pushing your hip back as you exhale. Now wherever you will feel is tight, needs some love, you will feel it there. In my case, it's a calf in the biggest way. So I'm holding it here, turning my chest 45-degree angle, and just staying here. So really rest yourself onto the chair, the back of the chair, and stay here. We'll stay here for another 10 seconds. Now remember, twisting a little bit to get this part here that is running, that can be tight throughout the pregnancy. We need to release that. Okay, 2 and 1, and release. Perfect. Changing the side. Again, I'm just touching up. If you feel like staying here longer, please do. Again, same with feet the same with your shoulders. And then inhale to prepare. Exhale, I will go down and turn my chest 45-degree angle, let's say towards the corner of the room. And again, if you have a mirror, perfectly check yourself. How does it look? And you might feel it, you need to feel at the back of your leg, the stretch happening there. Now, if it's tight, stay for longer. What I would invite you to do is breathe through it. Inhale and exhale. And each exhale, see if you can bring your hips even further back, okay? And now we'll release it from this positioning. What we also want to do is stretch your quads, because you want to keep your hips stable, and obviously some women can have a girdle pain. Therefore, I prefer to demonstrate you in the 3rd trimester stretches while you're using the chair. So you can simply go back to the chair, grabbing that leg, and then doing exactly what you would do while you're standing on one foot, but this is the option. So if you have a lower back problems and things like that, standing on one foot is not comfortable. That's why I do this stretch, but there are many other ways how to do this, yeah? So just as this is one of the options, what I would do. 2 and 1. Now you should feel all the stretch right here. And then you sit basically on the half of the chair, bringing that leg first down, seeing how you're gonna reach. Maybe lean a little bit forward, reach, and then hold that heel close to your glute, and like simply Keep your spine straight and stay here. Now I'm holding to the here because my weight is leaning to the side, so which I don't want to. So I'm just keeping it here and I feel my quads. This is my front leg muscles are being stretched, and that's perfect. You want to stay here for minimum, if you're in a rush, 10 seconds for up to 20 seconds. Okay, always go in between the 10 and 20, unless I talk too much. Okay, let's also stretch your hips in this way, where also you are supported, but now you'll cross your leg and bring your ankle on your knee. Now applying pressure onto your knee and slightly lean forward. Obviously, if you have a bump like I do, you can't lean very much forward. So applying that pressure onto the knee, and that gives you more room. So you just go with this one, keeping your spine straight. Now I feel my hips, the other hip is lifting up. So I'm gonna lean backwards, push that knee away and stay here a little bit with you. Okay, again, if that feels tight, mama, like I feel it tight, I would take the time for this stretch and slowly bring it down, and let's go for another one, yeah? So if you need a string to pull your leg up, please do, but again, keep your spine straight, slightly lean forward, again, and if it feels okay, apply a pressure here, keep your spine straight, and just hold it here. Hold it, hold it. Let's stay for another 5 seconds. Again, apply the pressure. If you feel like your hip is coming up, push it down, back, and just stay there. But my hips are very tight, so sleeping on the side doesn't help, because there were times that I was waking up with the tight hips. 2 and 1. Okay, and then the last one, we'll bring the knee first down. So 90-90, I call it 90-90 position to begin with. So you want to squeeze this glute. You will you bring your hips forward, yeah? Then hold on to the wall so that you are straight, and then lean over it, and you will feel this stretch opening here. Now, like a ballet, like make it like a balloon or maybe moon shape. That would remind me more. And you should feel it like in a hip flexor, yeah? Because these guys are very tight, especially if we are doing lots of walking, or anyways, because we bring our hips like forward. This needs to be stretched so that lower back is not suffering. Because what can happen when we have lower back pain, the hip flexors can be tight, okay? Okay, mama, let's switch it over. So we'll just turn upside down. 90-90 degrees first. What it means, ankle underneath your knee, knee underneath your hip. Perfect, and hold on to the wall when you're ready. So first, squeeze your glute, push it forward, and lean to the side. Now I feel my rib cage is opening, which will help me to breathe more with my diaphragm, which is very important for pelvic floor health. I have a video how to do the diaphragmatic breathing. And stay here, mama. 2 and 1. Excellent, bring yourself back. Now if you want to come up, make sure you support yourself, and simply as that. We are done for today. So you have done a great job at activated glutes with me. So I will see you next time. Please do repeat this exercise as much as you can, as often as you can. I would say 3 times a week, 2 times a week, so that your glutes are activated, especially when you're walking, when you're climbing up the stairs. They need to be supported and awakened so that they don't become sleepy, because this is the worst thing that can happen with you. First of all, you will lose shape, but also when you give birth, you have literally no bum. And this doesn't help for recovery or pelvic floor support as well, including your lower back, because you will be lifting your little one. So this is another way how to make sure that you are staying fit and healthy and fit for your little one, carrying, doing other activities, and so on. Okay, thank you so much for today, and I'll see you next time. Ciao!